I withdrew all my medication from the Pyxis and gathered my supplies. Now I'm in the medication room. I've checked the medication, the drug book. All the meds are within the expected range. And I'm going to check my patient's name of date of birth, which matches. He doesn't have any allergies, no contraindications. None of the medications interact. I'm going to perform hand hygiene. And I'm going to scrub my hubs for 15 seconds to 30 seconds and let them air dry. Fantastic.
And the next medication will be
Okay,
Ketorolac.
I had my patient's vitals taken, and I had his blood glucose taken within the last half hour. His blood glucose was 285. I'm going to be giving him 8 units of insulin. I'm going to start by drawing up my insulin. I'm going to inject 10 units of air into the insulin vial. I've already checked my medications. They match with the MAR, and they are not expired. I'm going to inject a little bit, over-inject the air. Make sure there's no bubbles. I'm going to draw up 8 units of insulin. I'm going to have another nurse check that I have withdrawn 8 units of insulin. I'm going to carefully recap my needle. And I label it with the medication, the dose, the patient's information, my initials, and the date. Next, I'm going to draw up my Ketorolac. I'm going to check the medication again. It's correct. It is a 30 milligram per milliliter concentration. The amount I need to give is 15 milligrams IM. So I'm going to draw up half a mil. I'm going to inject a little bit over half a mil of air into the vial.
And then with my thumb pointing to your belly button. So the injection.
And there's no air bubbles.
Okay. So, and then the insulin.
And this is going to go straight into a sharps container.
You're probably going to have a constipation, nausea, and
And I'm going to put on my 22 gauge needle. For IM injections, it's 22 to 25 gauge, 1 to 1.5 inch. My patient is not obese. I'm not going to use a 1.5 inch. I'm using the smallest gauge I can, 25 at a 1 inch. Okay, and I'm going to label my medication, patient's name, dose, and all the relevant information that it needs. I have my fentanyl patch. I'm going to double check my 5 rights one more time just for fun. Yep, everything matches up. I have all the supplies I need, and I'm ready to go see my patient. I'm outside the patient's room. I'm going to check again my 5 rights. I'm going to go over allergies, any relevant information, and everything is safe. So I'm going to arrive at my patient's room.
Yeah.
Hello, Mr. Reed. This is Emily. I'm coming in to give you all your medications. How are you feeling today?
Okay.
Good. And I know you're in pain, so I'm going to give you all your meds. I'm going to bring your bed up. I'm going to check your name and date of birth really quick. Can you confirm it for me? Great. And it matches your name tag. Fantastic. And you don't have, he's not experiencing any of the symptoms that would contraindicate any of the medications, so I'm ready to administer. I'm going to be giving you Ketorolac for your back pain. I'm going to give you neomycin ear drops for your ear infection. I'm going to give you a Duragesic patch, which is fentanyl for your back pain. And I'm going to be giving you your insulin because your blood glucose is high. Does that sound right to you? It does? Fantastic. We're going to start with your insulin because I want you to be able to enjoy your breakfast. So I'm going to pull this down. And it looks like they've been poking you on your left side, so I'm going to do the right side. I'm going to perform hand hygiene. I'm going to glove up.
And then quickly put inside your mouth. And then inhale deeply. And then close your mouth.
And I'm going to scan the barcode on the patient's wristband and on my medication. I'm going to sanitize the area I'm about to inject for
Before I give the
15 to 20 seconds. Right?
And
I'm going to let it air dry. I'm going to check one more time. You don't have any allergies, right? Okay, excellent. I'm going to give you your insulin then.
After 10 seconds,
I'm going to pinch an inch, and I'm going to go in at a 45-degree angle in a dart-like motion. I'm going to inject, not moving the needle while it's inside, and pull it out at the same angle. This is going to go straight into a sharps container. fantastic. There wasn't any bleeding, nothing I have to worry about. So I'm going to cover the patient up again. My lovely assistant, can you lift the sides of the bed? We're going to roll Mr. Reed over and give him his injections. Okay, and I already addressed his PQRST of pain, and that's why we're giving him his patch. Okay, next I'm going to go over the IM injection sites. The first one is the deltoid. So we're going to go 2 inches from the bone right here, and right here on the triangle, and that would be the first site. The next site would be the vastus lateralis, which is here, which we're going to go the greater trochanter, the patellar, knee, center of the center, and we'd give the medication here. The next one is the ventrogluteal. So we find the greater trochanter, thumb towards the navel, fingers towards the top of the iliac crest, and I would put my injection right here. But I'm going to do the vastus lateralis. And I clean the skin again, 15 to 20 seconds. And double check medication one more time.
Hold the skin.
I'm going to use the Z-track method. I'm going to pull the skin up an inch, inject at a 90-degree angle, pull the needle back out, and release the skin. This is going to go into a sharps container.
At least 2 inches from the belly button.
And I would bandage the patient in the clinical setting, but there's no bleeding here. Next, I'm going to put on your patch on your back for your pain. So I still have my gloves on. I've evaluated the patient. There are no other patches on his body, and I'm ready to put on this patch. I'm going to put it on his back where he's experiencing pain. I've cleaned the area, and I'm going to put the fentanyl patch right here without touching the patch with my fingers. If there was an old patch, I would fold it in on itself and dispose of it properly. Okay, you have your patch. Next I'm going to put in your eardrops, but I can cover you back up for that.
And then throw this into the...
Okay. I'm going to pull the patient's ear down and back and put in the 1 drop that's on his medication dose. Put a cotton ball in, and you're going to stay on your side for 5 to 10 minutes so that your eardrop can soak in, and then I would come back and do the other side and put a cotton ball, but I'm not going to show that here. Okay, you have your call light. Are you comfortable? Great. I'm going to put your bed down. And I would reevaluate my patient as the medications take effect for any of the contraindications. Ketorolac could cause some GI bleed issues, some heart palpitation issues, so I would routinely evaluate the patient for those concerns, as well as low blood glucose and respiratory difficulties from the opioid medication. So I'm going to remove my gloves, I'm going to perform hand hygiene, and I would chart all my medications in the MAR.